when you actually
It looks so right though.
Go ahead, Jenna.
Okay. So now we're yes. So now we're gonna perform the
Ophthalmoscope. Wait, do it for real. All right, we have to do it for real. Ready? One,
Wait,
two,
we're
three.
gonna go through the whole thing?
No, just the part.
Okay. All right.
Hey, keep going and say evaluation right after I say ophthalmoscope.
Yeah. Oh, evaluation. Oh,
Yeah.
gotcha.
Oh, shit.
Just say 3, 2, 1.
Okay. 3, 2, 1.
All right. So now we're gonna perform the
Ophthalmoscope. Whatever.
All right. So now we're. All right. So now we're gonna perform the ophthalmoscope exam. So ideally, we'd like to have a dark room. So I'm gonna.
What?
Please make a bloopers to this video. I'm telling you, I'll put that together. We will now be performing the halo sign test. So to do this, the patient is going to be either lying or supine. You're going to take some sterile gauze and...
All right, so now we're going to be performing the. Oh my god.
Sorry.
All right, so now we're going to be performing the tongue blade test. So this is testing for a mandibular fracture. So what I'm going to do is open the.
Oh my god.
And then the ninth cranial nerve is glossopharyngeal. So positive would be if she could not hold that position. And then. I have video. Alright, so now we're going to be doing lung auscultation, so listening to the sound of the heart. The lung. Alright, so now we're going to be doing abdominal auscultations. So I'm going to place the stethoscope on the patient's lower right quadrant. I can't. Crotch?
Lower right quadrant. You sicko.
Cannot talk today. Alright, so now we're going to be doing abdominal auscultations. So I'm going to put the stethoscope on the lower.
Damn it.
God.
Jenna.
Lower right quadrant.
Lower.
God.
So now we're going to go ahead and find their heart rate. You can do this at the radial pulse. Okay. No, just for
This next part I'll be doing is the abdominal auscultations. I'll get my fingers.
It's not auscultations.
Percussion.
Okay, so now we're going to be doing the jerk test, which is testing for any posterior glenohumeral instability. Hold on. Oh, I had a burp. Let me take my brace. Okay, I'm ready. Oh, okay. Okay, so now we're going to be doing Yergason's test, which is for bicep tendonitis or bicep tendon subluxation. So, sniffled.
You what?
All right, so now we're going to be doing the load and shift test for glenohumeral stability. So I'm going to have the patient seated in an upright position. And what I'm going to do is I'm going to grab and stabilize the scapula. Oh, shoot. I got to start over. All right, so now we're going to be doing the load and shift test for glenohumeral instability or stability. So I'm going to have the patient sitting in a chair, upright position. Okay, so now we're going to be doing the load and shift test for glenohumeral stability. So I'm going to have the patient sitting, and I'm going to...
she's gonna take off because of how I'm sitting. Sorry. I don't like the way it focuses. There you go. So now we're gonna do the bony palpations on the anterior aspect of the shoulder. We're gonna start at the jugular notch. And we're gonna move over to the sternoclavicular joint. We're here on the...
Do you know what? thought about that. I was like,
On the polo cuff? On the collar? Now we're gonna do the palpations of the anterior aspect of the shoulder. We're gonna start at the sternoclavicular. My apologies, we're gonna start at the
Sorry.
I'm not stopping.
Okay.
We're going, and here on the shoulder, we have the anterior aspect down into the deltoid tuberosity, the middle, God! Okay, I'm just gonna.
That's fine. I was like, biceps group. I never heard that before.
Okay. Now we're going, let me get in the camera, okay. Now we're going to do the grind test, which tests for, I don't really know. So.
I think it's a slap chair.
Oh.
I think, or a labral tear.
Okay.
I don't know. I don't really know.
I'm just gonna say labral. So.
It's on.
Due to the fact that we couldn't find this in any book, we winging it. So, this is the coracoid impingement test. We're testing for coracoid impingement. My patient is seating. Yeet. Positive is pain. Send her to the doctor.
Can we please submit this one? Can we please submit this?
Okay.
Yay!
Say something.
Me?
Yeah.
I don't have anything to say. Let's get this test done so we can go eat some bomb pain.
All right, I'm seriously gonna do it. Okay, so we're
All right, so now we're gonna do the Cosen's test, which is testing for lateral epicondylalagia. And so I'm gonna have the patient starting in pronation, and we're gonna do kind of like a handshake test. I'm also gonna palpate, have my thumb on the lateral epicondyle, and I'm gonna ask the patient to try and hold this position while I try and put her into supine. Oh, that's not right. All right, so now we're gonna be doing Finkelsteins or Finkelsteins.
Or whatever.
Or whatever.
This test is the TFCT load, or the triangular fibrocartilage complex, testing to see if there is a TFCC
You said
tear.
TFC.
This is the Watson's test, or the scaphoid shift test. I'm pinching her scaphoid right now, and as I'm pinching her, she's going to actively radial deviate or bring her pinky down to the floor. And ulnar deviate. This is backwards. Gonna be assessing the dermatomes of the lower leg, or this time I'll be doing myotomes, which is basically a break test assessing the muscular neurological integrity. Made no sense. The foot, that is more of assessment of the posterior tibial nerve. Posterior medial aspect, where the posterior tib nerve is located, and oh my god.
Okay, so now we're gonna be doing the crossover test. So testing for what?
Hey.
Oh, we're
Okay.
going to the side?
Oh,
You gotta get in there.
gotta get all of it. Yeah. Ooh, kill him.
Kill him with kindness.
Selena Gomez.
Selena Gomez. All All right, so now I'm going to be doing the Noble compression test. So this is testing for IT band syndrome. So I'm going to have and I'm just going to passively flex and extend. All right, so now we're going to be doing Trendelenburg test. So this is testing for